of lovers sleeping tight are rolling by like thunder now. As I look in your eyes, I hold on to your body and feel each move you make. Your voice is warm and tender, a love that I could not forsake. 'Cause I'm your lady and you are my man.
Thank you, Jules. Hey, welcome to the What's Happening show. I am your host, and we have a fantastic show lineup today. As you can see, Jules came in with her rendition of Power of Love. And I have on the set Linda Scott from 16
LS 14?
14
26.
26. And this is our Christmas show. It's the feast of all season. And we're doing this fabulous fashion show here at Dillard's in Plantation, Florida. And Linda is the gorgeous woman who put it all together for us. Welcome, Linda.
Thank you, thank you.
Linda. Welcome to the show.
Thank you for having
What's
me.
happening? You just flew in from Houston, right?
I just flew in from Houston
Yes.
just to be by your side. I would do it again if you
we're
asked
going
me
to do it
to.
again.
Okay, no
We're gonna do it
problem,
again.
no problem.
All right.
Yes.
Linda, talk about your 1426 before we get really into things.
Okay, LS 1426 is about full-figured women.
Okay.
And what we do there is we empower them and we give a training with an academy now coming to the back of our
Okay,
end. So
yes.
now it's LS 1426 Academy.
All right, we're going to talk about that part of it.
Okay, so that part is teaching not just plus size, but young ladies and men about the modeling business, coaching them and getting them prepared how to walk into an agency and go get jobs.
Okay,
Yes,
all right.
that's what we're doing.
All right, very good. Well, of course, today we have that fabulous show set up here in Dillard's. And we're going to see a variety of clothes from Dillard's for the holiday season. And we want to thank Dillard's for hosting us because we are upstairs on the second floor, as you can see. And we're all wearing Dillard's outfits.
Yes.
Dillard's is partnered with What's Happening because they provide all our wardrobe.
Okay, good.
Everywhere we go, Dillard's walk with us. So we're here in the Dillard's department store. Fine, beautiful clothing, fantastic professional clothes, party clothes. All right. Now, LS, you were telling me about LS. What LS is? Yeah.
LS is a whole lot of things now.
Oh,
I
really?
mean, we started out
A whole lot
just
of things like...
a whole lot of things.
Okay.
We're actually taking it to the next level, and we're doing a full-figure fashion week as well.
Okay.
So LS 1426 is of consulting and modeling and designers, where we bring in new designers and we introduce them to South Florida and to the market of designing as well. And then we do consulting with models.
Okay.
And like we said, we educate them about the do's and the don'ts.
All right.
How to know that this is a scam or this is real.
Oh, okay. Yeah,
So
there are a lot of scams
that's-
out there.
Yes.
Yes.
And that's what LS 1426 does. Now, we are also in partnership with Posh Modeling Agency,
Okay.
where we prepare them here at 1426, and then we go say, Posh, these girls are ready for you. And that's how the relationship is done. That's how we fund it.
Okay. All right. The question I wanted to ask is, with 1426, didn't you do a piece where you actually, it's a program where you kind of do the self-esteem thing? Are you still doing that, Linda?
I told you, girl,
Yes.
we so into everything now.
Yeah.
And self-esteem is so big nowadays because, you know, we have all the bullies and all this going on in school, and we just have to train our kids to love themselves, regardless what you say negative about me. It's something positive in what you said. So the self-esteem itself is one of our main keys that we
you're
work on.
emphasizing on.
Yes.
We're going to take a break, and when we come back, we're going to just talk about the latest modeling.
Okay.
And then, of course, juvenile diabetes is part of our topic today.
Yes.
So we'll chit-chat a little bit about
Okay.
that. Okay.
All right.
We're going to be right back. And of course, Linda and I will tell you more about the fashion show. Stay tuned. Welcome back to What's Happening. Of course, Linda Scott is on the set with us today, and it's our fashion show day, and we're at Dillard's. It's Feast of the Season.
Oh, thank you.
All right, Linda. So we're going to see the fashion show now.
Yes.
And you're hosting.
Yes.
And you're emceeing.
And I did a great job.
And you
oh,
did.
girl.
All right. Okay. All right, Linda. Before we even finish with this fashion show today, talk to me about the rest of your LS. I know I heard you during the break telling someone more in details, but you didn't tell us.
Oh my God, Maxine.
Yes.
See, when people ask me about LS14, I get
Yes.
excited.
Yes.
So what I was telling him was what we do,
Yeah.
and we cleanse our young people, our older people, and it starts from adolescent to adulthood. And we clean the inside out, because
Okay.
once you feel good and pretty on the inside and you know who you are,
Yes.
nothing that anybody could tell you negative about anything that is going on.
And it would not affect.
And it would not affect you at all. So that's our main goal, is empowering
Okay.
us to do better, to be better people tomorrow, not only in the fashion world, but just to be better and love yourself.
Okay. All right. Well, now during this Christmas festive season, and everybody's loving everybody, and we're
yes,
wearing red, and we're wearing the bright colors. What are we seeing today in the fashion show?
Today in the fashion show, we're seeing everything that Dillard has in the Christmas season.
Right.
We're showing the little kids, the teenagers, and then we're going into the adults and the
Okay.
big men.
The big man.
The big men.
Okay.
So
You
we
had some
have
little men too?
little men. We
Big men.
have
Okay.
from a size 0
Uh-huh.
to a 20.
Wow.
Yes.
To a
yes.
20?
So a
Yeah.
20.
Okay,
And
okay.
those girls are curvy and looking good.
And looking fashionable.
Yes.
All right, of course. Well, you know, I changed into another bright color. Just to
Yes.
show off a little bit of Dillard's.
I know.
Because in the next segment, we're going to bring on Gabby.
Yes.
Gabby, who's responsible for setting, dressing the
Every-
mannequin and making sure that the fabulous
His
clothes
best.
are displayed. So we're going to have her on. But Linda, they have been absolutely, absolutely wonderful.
And
wonderful.
I would love to do another show here with them. I mean, the workers were on top of everything.
Everything. Weren't they?
Yes.
Very cooperative.
Very cooperative.
Yes,
I
and they-
mean, I couldn't ask for a better. The designers that we had to choose from in the store were like Betty and, oh God, they're going to kill me, Betty and Adam.
Okay.
We had BC and BG.
Okay.
So, I mean, they just have everything
Right,
in the
okay.
store, and we pulled
We
them
did put
out to
together.
showcase them.
Right.
Yes.
One of the things that I wanted to acknowledge too is our sponsor. They didn't show, however, it's okay, but we have to talk about them.
Okay.
And that's Dr. Anir Opako. He's a
Okay.
certified plastic surgeon. And he's it. I know everybody's talking about doing the
yeah.
and the right, but he wasn't here to talk about all that.
Right.
However, he is our sponsor. He's responsible for the production today. He's located down in Miami. You can call our office. We'll give you further information. And our office number, I'll tell you at this time, is 954-233-0212. And he's an excellent, excellent plastic surgeon. He works on a lot of the movie stars, I would like to
Okay.
say, and celebrities, doing the tucks and and also he works on women and men who have lost over 100 pounds and they have all this flesh
Oh,
hanging.
yes.
He has a specialized service in which they peel, he's able to peel off all that extra skin and leave it very smooth.
So I can go have that surgery.
You can have
done.
that if you lose 100 pounds or more, Linda.
Okay, then I
But
can't lose 100
I'm just
pounds.
sorry he wasn't here. But
Yes.
we want to say thank you, Dr. Opako.
Yes.
We love you. We support you, and we're going to get some folks in if they need your services. We're going to send them to you. And of course, we know, Linda, because I'm going to talk to Gabby, I won't see you in the next segment.
Oh, but I have something for you.
What do you have for me?
Because today was the day that you brought in the juvenile diabetes.
Right.
We have come together, us and Dillard,
Okay.
and everybody in the area,
Yeah.
to give you this.
What is this?
This is money for your research.
Oh,
to
thank
continue
you,
to do
darling.
this, and we hope
Thank
that
you.
it serves a purpose to you and for you,
Oh,
and we
thank
really
you.
appreciate you bringing the awareness out,
All
because me myself was not aware of juvenile diabetes.
All right. Thank
All
you,
right,
Linda.
thank you.
All right. Stay tuned. We'll be right back.
Are you ready? Dillard is bringing it to you today. The excitement is here, the models are great. The purpose is awesome. This show today is to help our young ones with diabetes. And you know what that is? Juvenile diabetes. That's the purpose of this show. Also with Dillard's doing what they have to do for the Christmas season.
Welcome back to the What's Happening show. I am, of course, your host, Maxine Tulloch, and on the set at this time is Dr. Barry Chef. He is the CEO and president of University Wellness and Weight Loss Center. And of course, Barry put me on his program and I've lost 30 pounds. So we have him on here today to talk to you and tell you about his program. So welcome, Dr. Chef.
Thank you for having me.
All right, let's talk about your program. Tell our audience what you did and why you even started it.
Well, you should be an expert in the program by now.
I am, of course, but let's tell our audience the right way to eat.
Well, I don't know that I can tell the audience the right way to eat, but what we try to do is make people aware of the effect that food has over them. When we eat, certain foods that we eat influence the hormones that our body produces, and the hormones drive our behavior.
Oh.
So that foods that are high, as you alluded to previously, in carbohydrates, they tend to increase certain hormones called insulin.
Right.
That drives hunger. And a lot of people don't understand the effect that that has on them. Other foods influence other hormones, such as glucagon, and that creates satisfaction from the meal.
Okay, glucagon.
Glucagon.
Ah, okay. And what do you mean by creates satisfaction? You mean when we feel for that piece of chocolate and we eat it, that's the satisfaction, but it's bad.
Well, that's truly not satisfaction. Sometimes what we think are our friends are actually not our friends. The initial sensation from the piece of chocolate or whatever you might crave is comfort from the food and satisfaction, but then the villain is the insulin,
Okay.
one of the hormones that your body produces that creates cravings and hunger shortly after you eat it, and you want more.
Okay, okay. All right. Now, Doc, what's your program like? If a patient comes in, what is it that you do with them, and how do you get them on that regimen? So,
Well, we meet the patient, we evaluate their height and their weight and how much how much weight they need to lose, if they need to lose any. We get an idea of their medical condition and how they've been eating, and then we make suggestions as to what the root cause is of them being overweight, and then we remove the things that stimulate their appetite and create an environment where they begin to get control over food as opposed to food having control over them.
okay. All right. Now, on that program, you're a cardiologist.
Yes.
And tell our audience part of the reason why you even started that weight loss program.
Well,
Briefly, because we only have a few minutes.
I got you. Well, for 25 years I've been practicing cardiology and been encouraging people to lose weight and exercise, and for the last 25 years my patients, as well as most of America, has gotten progressively overweight. 70% of America is overweight, a third are obese, and obesity and sedentary lifestyle is now the #2 preventable cause of death in this country. Yet most insurances for patients don't cover wellness and weight loss. So I went out on a mission, decided to come up with a solution for my client base being overweight, and found a program that is user-friendly, achieves relatively rapid weight loss. As you know, 15 to 20 pounds the first month, 10 to 15 pounds each additional month, but in a manner in which is not offensive. It's easy.
Okay, all right. Well, Doc, we have 1 minute, and at this point, I want you to tell our audience how they can get in touch with you if they wanted to start your program and even just wanted to consult with you about their weight loss? Tell them how.
Well, you can call us at 954-628-3802, or if you want to learn more about our program, go on the web, www.docsweightloss.com. That's docsweightloss.com. Explore the page, learn a little bit about our success stories and our way in which we approach weight, excess weight and disease management, and see if it fits for you.
Okay, very good, Doc. Well, thank you so very much for being on the What's Happening show. And I'll be in the office next week to make sure that I'm doing what I'm supposed to do.
And we'll be ready for you.
All right.
Thank you so much.
Thank you. Thank you. But stay tuned. We're going to be right back. Don't go anywhere. Welcome back to the What's Happening show. Of course, I told my audience previously about my own grandson who was diagnosed recently with juvenile diabetes, which is type 1 diabetes. And part of today's production, we have as a special guest on the program is Eden Carr, and she's the executive director
Correct.
for Juvenile Diabetes Research Foundation of South Florida.
Correct.
Because there are many chapters all over the United States.
Yes.
All right. So just help me to welcome Eden to the set of What's Happening.
Thank you, Maxine.
So we're going to find out what's happening in the research foundation of the juvenile diabetes.
Awesome. Well, actually, we have so much going on, and what we do is we're a fundraising organization, and we have chapters, as you mentioned, across the country, and actually 8 affiliates around the world. And all are raising money to try to find a cure for type 1 diabetes and its complications, which can be quite severe. And
let me cut you quick. You said to find a research. How close are you to finding a research?
Well, you know, we
cure.
always hope for a cure tomorrow, but the reality is that while we are waiting for a cure, our goal is to make the quality of life for those living with diabetes better and easier. So we're looking for advances in therapies and innovative devices, and I know your grandson is active in the Maryland chapter of JDRF.
Right.
And so what we want to do in that time frame is also educate people a little bit more about what type 1 diabetes is.
Okay. And what is it?
Type 1 diabetes is very different from type 2 diabetes. It's where your body does not produce any insulin. So it requires that a person, usually a child, but adults are also diagnosed with type 1 diabetes. It requires you to be insulin dependent for life. There is no cure currently for type 1 diabetes, and unlike type 2, that can be modified with diet and exercise and possibly be in reverse. We actually have children that it's not because they ate too much candy, it's not because they live a sedentary lifestyle, it's because their body does not produce that insulin that is needed for energy, that converts our food to energy.
Okay. Well, I'm telling you now, Eden, that I was very ignorant when my daughter-in-law called me and told me, Mom, Rial was diagnosed. I said, what? All of a sudden my mind is, you're giving him too much sugar, you're giving him too much cereal, cut out the cereal, no cereal, you should eat natural. And I wasn't even aware that kids had diabetes. That's such an awful disease for a child to have. Now, how does the foundation help? And I know we have coming on the set a family, a mother with a daughter who was diagnosed at 4 years old.
Right.
But it's just, I'm brokenhearted, you know, to know a child have to deal with this disease. Now, you know, how do you help?
It is a very tragic diagnosis, obviously, and when a family learns that their child has diabetes, as I'm sure you experienced with your own family, you don't know what to do. You're grieving, you're in denial, you can't imagine such a terrible fate, especially with there being no cure. So that is one of the things that JDRF provides, is counseling and support and resources for newly diagnosed families. We have a bag of hope that is a teddy bear with all kinds of tools for parents, carb counters, and information to help ease their way into this new life that's going to happen for them now.
Yes. All right. We want to bring on, what's the name of the mother?
Tara Edwards and her daughter Candace. And Candace is an amazing 10-year-old who, like you said, was diagnosed at 4. So she's been living with type 1 diabetes for 6 years now.
What does it do to the mom? You know, I'm like, oh.
Well,
really.
you know what it does to the grandmoms. You just have to be more supportive and love them even more. But it does affect the entire family, including siblings that now have to adjust their lives because there's no vacation from diabetes.
None.
None. 24/7, 365 days a year. They have to test their blood sugar multiple times a day and take insulin to regulate their blood sugar. So Candace, I'm sure will tell you more about that.
Right, but in the history of the organization, have there ever been any reversed at all?
Well, we're looking at therapies like islet transplantation and different things. A pancreas transplant obviously is an answer, but there's not enough pancreases available, and that's very invasive surgery.
Right.
So we really feel like our best chance is to find what causes type 1 diabetes, go for the cure, and in the meantime, help the quality of life while they're living with diabetes.
All right, we're going to take a break now, and then we'll bring back Candice and her mom and talk to them more about that.
That would be wonderful. Thank you so much.
All right. Stay tuned. We're going to be right back. You'll get to meet Candice, who is living with diabetes. Don't go anywhere. Welcome back to the What's Happening show. Now, in this segment, we are bringing on Candice and Tara, who is, Candice has diabetes, and this is her mom. So we're going to talk to them and ask them a few questions about how mom coped with her little baby being diagnosed with diabetes. Now, Tara, when the doctor told you Candice was diagnosed as having diabetes, what thoughts came to your mind, and how did you handle that news? Huh?
Do you really want to know?
I really want to know, and our audience really want to know.
I was dumbstruck.
Yeah.
I was sad. I was confused, but I had to deal with it.
Yeah.
And she was only 4. I was like, my 4-year-old, no.
Yes.
But you know, we get faced with challenges. It's just for us to grab a hold of ourselves and having dealt with it
Yeah.
this long. She's 10,
Yeah.
almost 11.
Yeah.
It's not my strength, and I could not have done it on my own. And thankfully, she is responsible, and you know, she's gotten over the initial shock.
Of it.
And so
All right, at 4 years old, what happened while did you take her to the doctor?
she was ill for a few months, and we weren't sure what it was. She wasn't getting better. She had an ongoing ear infection, and you know, it was just a number of things.
A series of things
happening. And she had a birthday party.
Yeah.
And she came home and she couldn't speak. She had laryngitis. She had hives. She just was a total mess.
Yeah.
So we took her in. She was medicated for a week, and then we went back for follow-up.
Right.
But during this time of taking the medicine, we realized some things that were strange. You know, like accidents at night. She was sleeping in
Accident?
class.
Oh, it's the bed accident.
Yes.
Yes, okay.
And she was falling asleep in school. She was drinking like 10 bottles of water a day.
Wow.
And she was still not herself.
Yeah.
And so, you know, the doctor did her recheck. She's like, you know, is there anything else you want to talk about?
Yeah.
And I decided to start telling her everything. And she's like, something doesn't sound right. So she thought it was a UTI before because she's peeing so much.
Yeah.
She checked, and then she said, there's one thing that's bothering me.
Yeah.
She went and she checked, and she came back. And the moment she walked in the room, I knew something was wrong.
Yeah.
She's like, Mommy, do you want to sit?
Yeah.
It's like, what?
What is it?
And then she says, is there anybody in your family that's diabetic? And I started thinking, yes.
Yeah.
And I'm like, what are we getting to?
Yeah.
And then she said, let me make a few phone calls. And well, unbeknownst to us, I had no idea that she was moments away from being comatose.
What?
So now we label her a miracle baby.
Oh, all right. She is a miracle. She's a pretty miracle baby.
Yes, and I mean, we have had to change her life, but we do not let it control us. And it's nice that we're making people aware, and thankfully we have JDRF. She's met friends and, you know, other parents her age, so she no longer thinks she's different.
Different.
Yeah.
All right. Now, Candice, tell me now, what do you think? At 4, did you remember that? 4 years old?
Yes.
You did?
I remember going to the hospital
Uh-huh.
and getting my first IV. It was really scary.
Really? Your first IV. So, what's a typical day for you as a diabetic kid?
Getting shots 5 to 7 times a day.
What? Really? Oh my goodness. So how do you deal with that, Candice? It's okay now?
Yeah, it's okay now. I get used to it. It's like a daily routine for me
Yes.
since I've been doing it for 6 years.
Listen to her. Okay. All right.
And yeah, my friends, like, they know that I'm diabetic, and like, they don't think that, oh, you're different, you're disgusting, or
No.
whatever. But like, they cope with it. Like, if I go over to their house, they like watch out for me.
Uh-huh.
Like, they tell me that this has a lot of sugar and all that, but I'm like, I'm fine, just as long as I eat a certain amount of it,
Yeah.
then I'll be fine.
Okay. So you have to watch what you eat, so you don't eat the regular junk food that other kids are eating, right? That's loaded with sugar, right?
Not a lot of it.
But you eat some?
Yes.
That's all right. So you do your own shots? You take
Yes.
your own shot? Oh my goodness, that's all right. my grandson was, so I'm not sure. I mean, he's acting like a regular kid. He's not.
Yes.
Yeah, they do act like a regular kid.
It's important that they do.
Yeah.
In the first couple of years, it was really difficult because how do you tell your child that you can only have a half of a cookie?
Half of a cookie. Okay. Well, listen, we're running out of time.
Yes.
But I do thank you for being on the show.
Thank you for having us.
And I wish you all good luck.
Thank
And
you.
I'm going to be calling because I need to find out more about this beautiful young lady who sounds so mature and dealing with such a dreadful disease. But I wish you all the best, Candice. Can I get a hug? Oh, you gorgeous girl. Thank you.
Thank you,
Mom.
Lovely meeting you. Thank you.
Thank you. We'll be right back. Welcome back to the final segment of the What's Happening show. I am your host, Maxine Tulloch, and we're going to just wrap it up. We have coming up Jules, or reggae artist, or up-and-coming reggae artist. She's a beautiful young lady, and she's going to end this show with a fabulous song. But seated beside me at this time is Gabby. Gabby's a person I work with here at Dillard's, of course. She helps to choose the clothes for the Maxine show.
We do.
The Maxine Tulloch show and the What's Happening show. So we're just going to chit-chat with her just for a minute to talk about the Christmas season and what's happening here at Dillard's. Gabby, welcome to the set.
Hi, thank you. Welcome to Dillard's.
Oh, welcome. You know I live here. I'm part of the family
We
here.
have fun here,
Yeah.
yes.
And it was my pleasure bringing this episode at the store that's so festive.
Thank
now,
you.
I know that you do a lot in getting things prepared. And since you've been here, the store has a new facelift.
Thank
Tell me
you.
what you do to bring this new excitement to Dillard's.
Well, we're on the floor every day. We just merchandise. We get lots of great merchandise in. We just, working on the presentation, helping customers, just having fun, working on everything every day.
All right. Well, so far, Anya, who is your store manager,
Right.
she's here but not available to come on the set at this time. But with the fashion show, you were able to work with Linda.
Linda,
All
yes.
right. How was that for you?
That was so fun.
Yeah.
She had all the models in.
Yeah.
So we're just picking out the outfits, seeing what looks best on what body type, on which model, and, just having fun, providing different fashions that you can wear for holidays, for parties, for, after hours, whatever they wanted to do with it. So we had lots of fun.
Lots of
We're
fun.
so glad to have a fashion show here.
All right. We're going to do this next time. But of course, part of it was with the juvenile diabetes,
Right.
type 1, which we had Eden on, who talked about,
Right.
kids with diabetes, which is a serious situation. However, I just want folks to know that these fabulous dresses behind me is part of Dillard's couture.
Right.
Should I say
Dillard's
it?
fashion.
Dillard's fashion. And everything we wear on the set is from Dillard's. So we want you to support. Come on in. The employees here are fabulous. As you know,
Thank you.
Gabby's fabulous and beautiful herself.
You're fabulous and beautiful. We're so happy that you're our model for
Oh,
Dillard's Fashions. You
I
make it
know,
look
I
so
know.
beautiful.
Thank you. And
Thank
I
you.
appreciate it. So that's going to be it for us. I hope you have a wonderful, fantastic holiday. I'm going to bring Jules in, and she's going to close out the show with her beautiful voice. So Jules, take it over, and I'll see you. Happy holidays.
Happy holidays. Thank you.
All right. Thank you, Gabby.
Thank you.
All right, Jules, take it over.
Don't cry for me, my Jamaica. Truth is, I never left you. All through my wild days, my mad existence, I kept my promise. Don't keep your distance.
All right. One more time, Jules. Give us one more. Yes. And then we can go.
It won't be easy. You'll think it's strange when I try to explain how I feel. That I still need your love after all that I've done. You won't believe me. All you will see is a girl you once knew, although she's dressed up to the nines.
All right.
At 6s and 7s with you.
All right.
Beautiful.
Thank you. All right. See ya.
This episode was brought to you by Ocean View Plastic Surgery. Dr. Okpaku is one of the most sought-after plastic surgeons in South Florida. Call for a consultation today.